No, they do. Well, you know, I'm from West Virginia and then spent 7 years in Colorado. So this is awesome. I love this. Just don't talk to me in July.
Madam Chair, we are live.
No, they do. Excellent, excellent. So let's get started. Thank you, everyone, for dialing in. If we could do a call to the roll call, Dr. Red. Dr. Red.
Yes, ma'am. Good morning, everyone.
Okay, we're ready for the roll call.
Okay. Ms. Pamela Curry,
Here.
Dr. Christine Darden,
Here.
Mr. Charlie Hill,
Present and accounted for.
Mr. William Murray,
Present.
Mr. Xavier Richardson,
Here at VSU. Here.
Mr. Wayne Turnage, Mr. Gregory Worley,
Here.
Mr. Huron Winstead, who's Director and ex officio.
Good morning.
And we'd like to recognize Mr. Cameron Gray, our STA representative, and Dr. Shabanu, our new faculty representative. Madam Chair, you do have a quorum.
Thank you. Welcome, everybody. Do we have someone to do the invocation for us?
Mr. Rodney Hall.
All right. Let us go before the Father. You are the God of covenant and of faithful promises. Time and time again, you have proven you'll do just what you said. Though the storms may come and the winds may blow, we will remain steadfast. Keep, protect, and strengthen us mentally, physically, and spiritually as we navigate through this pandemic. And let our hearts learn when you speak a word, it will come to pass. Great is your faithfulness to us for now and forevermore. Amen.
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 Thank you, Mr. Hall. If we could get the approval of the agenda, all in favor say aye.
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 Thank you. And then we will need a motion and a second, and then a roll call to approve the previous meeting's minutes. And also, if anyone has any changes to them, please note that now.
I make a motion for the adoption of the minutes as presented.
I second it.
Thank you, Mr. Richardson, for the motion and Mr. Hill for the second. Dr. Red, if we could have roll call.
Dr. Red?
It always takes a moment to unmute myself, so I appreciate your patience. Thank you. Ms. Pamela Curry. Ms. Curry. You're muted.
Unmute.
Okay, aye.
There you are. Okay. Dr. Christine Darden.
Aye.
Mr. Charlie Hill.
Aye.
Mr. William Murray.
Aye.
Mr. Xavier Richardson.
Aye.
Mr. Wayne Turnage. Mr. Gregory Worley.
Here. I'm aye.
Thank you.
Okay, that sounds good. Now we can move on. And if I could just take just one moment before you begin, Dr. Abdullah, I would like to say that we have a very full agenda. We don't have any action items this time, which is unusual for us. but we do have a very full agenda. We will be discussing the SCHEV institutional performance standards, and I wanted to make sure that all the members of this committee knew that I'd like to really have a good conversation about this when that item comes up. And then tomorrow at the full board meeting, we will have a couple of the folks from SCHEV available to answer any questions or go into anything more fully about what the process is and how we do this. Dr. Palm, Kevin Davenport, the president, have all been working very closely with SCHEV. And Bill Murray, as a former SCHEV member, knows well how hard the SCHEV folks work with institutions, and they have truly been helpful to us in understanding exactly what their actions mean and what the path is going forward. They've been very explicit in comments to me about the fact that this has nothing to do with accreditation. This is an administrative and financial issue that's laid out in the budget of the Commonwealth. It was started during restructuring, all the way back in 2006 or 7 maybe. So just with that as preface remarks, Dr. Abdullah, I'll hand it over to you. And one other thing, Dr. Murray has to leave at 10. And so after you've finished, Mr. President, Dr. Murray, if you need to say anything, or if before you leave the meeting you want to say something, please just let me know.
Will do.
Thank you.
Thank you, Madam Chair.
Thanks.
Thank you very much, Madam Chair. And I know that there is a full agenda, of course, including the SCHEV report, the enrollment, our regular reports, and of course our reopen plan. And so I'll be brief. I'm going to use my time to just introduce our new Faculty Senate Chair who has joined us. Dr. Czeslaw Shibanu is a professor in the Department of Mathematics and Economics. He is of course the chair of the Faculty Senate, and he has served as the chair of the Tenure and Promotion Committee for a couple of our years here at Virginia State. I think most impressively, and I wanted to share this, he received his PhD in Moscow from Lomonosov State University in Russia. And prior to joining Virginia State, his career spanned a global range that included being the ambassador of Moldova to the United States and Canada, the deputy foreign minister and a member of the Moldova's government, and the first minister of privatization. He also at one point served as an advisor and interpreter to the former president of the USSR, Mikhail Gorbachev. And so he was a giant before he came to Virginia State, but more importantly, his contribution to Virginia State has been very well recognized. And we're proud to have him on faculty and proud to have him as the chair of the Faculty Senate. And that concludes my report, ma'am.
Thank you, Mr. President.
Thank you.
Thank you for your comments, and we are honored to have you join us. Always to have any faculty member with us, but given all of your accomplishments, we really appreciate you being here, and we will have time at the full board meeting for you to give your remarks, but please feel free to join in, ask questions during the course of this meeting.
Thank you, Ms. Karen. It's an honor for me to be part of this distinguished family.
Thank you. And now I'm going to turn it over to Dr. Palm to sort of run the rest of the agenda, almost the rest of the agenda.
Yes, thank you, Madam Chair. Mr. Rector and board members, good morning. We do have a full agenda, and I'm excited to actually work through the agenda. At the beginning of our agenda, we're going to go ahead and have Ms. Clemens talk about the reopening plan. And so I think, Hubie, I believe you are driving. If you can pull up Ms. Clemens' reopening plan to present to the board, that would be great. And again, if I haven't introduced Ms. Clemens, I think you may have met her before, but Ms. Clemens, she actually is a VSU grad, an alum, and she is now our director of our health center, and she started back in August. So of course she hit the ground running right in the middle of COVID. And I think the first day she started, there was a hurricane. So again, she is battle tested, and she's actually helping us get through this this whole COVID-19 reopening plan. And so I'm really happy to have her on the team.
Thank you. Good morning, everyone.
Good morning.
Good morning.
So we'll have Mr. Harris pull up your presentation.
All right.
And on Diligent, it's on begins on page 17, begins your outline, and then follows from there.
Let me try to connect with Mr. Harris to see if he's having problems pulling it up.
And I was wrong. The reopening plan doesn't begin on 17. I'm trying to find where it begins, if anybody's following along on Diligent. Have we gotten through to Mr. Harris? There we go. The reopening plan starts on page 51 in Diligent.
Yeah, I did just get in touch with Mr. Harris. He's working through a technical issue. He'll be right with us.
Okie doke. You know, I think I may have mentioned it before, but I had the opportunity to be part of my grandkids' virtual classroom for Generations Day up in Baltimore last month. And if you think having technical difficulties is challenging when you've got a classroom full of adults, such as ourselves, can you imagine what the teachers are going through who have, you know, kindergarten? Two of my grandkids are in kindergarten and 2 are in 3rd grade. Can you just even imagine what they've had to go through and what the parents and caregivers are going through and the kids? It's just crazy.
Yeah, that's something we're trying to be mindful of too. That it's I know it's a struggle at some of the lower levels, but I think it's also a challenge. It's a challenge at every level, you know. And
Absolutely. Absolutely. And what our faculty have done to turn on the dime on this is just truly remarkable.
It is. It really is. I'm trying to think of alternative plans as Hubie has challenges with his technology.
So it is in Diligent. I don't know if folks can, you know, I've got, my son-in-law is a techie, so I've got all kinds of devices. I don't know if everybody can actually pull up the presentation while still being on this meeting or not. And we probably just need to make sure we get the technical difficulty worked out, I guess.
Yeah, I think so. Hubie's critical to this. You're right. We probably should just be patient and wait for him. I'm sure he's doing everything he can.
That's good.
Madam Chair, can you hear me? Madam Chair?
Yes, I can hear you.
Could we not move forward and circle back on her presentation once that's resolved? Since we're starting off with a very tight schedule.
I was
resolved.
assuming, and I shouldn't assume anything, but I was assuming that it was an issue with all of the uploads for presentations. But excellent question, Mr. Hill. Looks like we've got it.
It looks, sorry for talking across you, but it looks like it may be resolved, and I see the agenda on my screen now.
Yeah, I can see it as well. So that's progress. And I think they are all integrated perhaps, so I'm not sure that we can.
Yeah, so they're working their way through the presentation part of Diligent.
Mr. Harris is just having trouble sharing, apparently. I
Right.
see progress.
Great. All right, so we'll go ahead and get started. As previously mentioned, my name is Tanika Clements, and I'm the Director of Student Health Services at Virginia State. You can go to the next slide, please. Okay, so the reopening plan was done in alignment with the governor's 4 focal areas and the State Council of Higher Education guidelines. These focus areas included repopulation of the campus, monitoring health conditions, containment to prevent the spread of disease when detected, and shutdown considerations. So prior to the reopening plan, establishing it, we had to work with our community partners, both external and internal partners. And some of those partners were the Department of Health, Bon Secours, and internal partners included task force committees at Virginia State. When working with these internal and external partners, we looked at best practices, and also during this period, we had the opportunity to look at some other institutions across the state and their reopening plans and what worked and did not work. Next slide. Go back up one. Go back up. We're skipping a few, I believe. Oh, I'm sorry. Right here is good. This is it. Okay. So in preparing for reopening, we started with repopulation of the campus. Some of the items for repopulation are training modules, COVID-19 training modules for faculty, students, and staff. And these COVID-19 training modules include measures on explaining how COVID-19 is transmitted, measures individuals can take to reduce the spread of COVID, understanding health and safety skills, including proper technique for hand washing, using hand sanitizer, putting on and taking off mask or facial coverings, and also taking temperatures with an oral thermometer. In addition, Student Health Services created a handbook which outlines the clinic workflow, triage scripts for student health and residence life staff, quarantine and isolation procedures, and also telehealth procedures. In our calendar to reopen, our move-in process will begin in the end of January of 2021, and the first day of class is slated to begin February the 21st. Next slide. All right, so as part of repopulation of the campus, students will be tested during the move-in process. The testing is slated to take place at Daniels Gymnasium. This testing will include both the a rapid point of care test in which the results can be processed within 15 minutes by Student Health, and then also a PCR-based test which has to be sent to a lab for processing. The PCR test results, because it has to be sent to a lab, can take days to receive, but it is more inaccurate and is the gold standard for testing, whereas the rapid test is generally used for symptomatic individuals. However, it can be used as an off-label use for testing asymptomatic individuals. The rapid test does have an ability in asymptomatic people to have false negative reports, and that is why we would back it up with a PCR-based test. Next slide. All right. In consideration of repopulating the campus, faculty and staff will be strongly encouraged to get COVID-19 testing prior to this start of the semester and throughout. For testing of faculty and staff, it is strongly encouraged that they recommend their primary care provider for an appointment to get screened, or they can also utilize resources such as Patient First. In addition to that, we are looking at contracting staff to assist with COVID-19 testing and surveillance testing of faculty and staff as well. Also, considering surveillance testing and mitigating the spread, 15% of the population will be tested monthly for surveillance testing. And this will help us to help mitigate the spread. And in addition to the testing protocols, it will be strongly encouraged for students, faculty, and staff to have good hand washing, mask wearing, and also social distancing protocols. Next slide. Okay. In addition to those measures that I've just mentioned, there will also be daily health screening questions or self-monitoring form that would be given to faculty, students, and staff, where they can monitor their symptoms daily. This can be is currently in a paper form, but it can be sent on our website. Or an app for easy administration. In addition to that, we're looking at implementing hands-free temperature screening stations in high traffic areas throughout the campus. So the picture on the slide is an example of some of the hands-free temperature screening stations. So it's similar to an infrared thermometer, so to speak, if you all have seen that. But this one you would just walk up to and it would scan your temperature. Next slide. All right. We have also have isolation and quarantine spaces in Whiting Hall, which are 55 spaces of single rooms for students who test positive for COVID-19. They will be given the option to either return home or go to isolation in Whiting Hall. If they do decide to return home, then they would need to sign a waiver stating they understand the risk of returning home. And also they would need to follow up with their primary care doctor as well, just for screening and also to get a release should they return back to campus. All right, so focus area 2, monitoring health conditions to detect infection. So student health will acquire additional clinical staff and have a COVID-19 care team. So the COVID-19 care team would assist with surveillance testing and also testing for those who are symptomatic or asymptomatic for COVID-19 or have flu or COVID-19 symptoms, since they mimic each other. In addition to monitoring health conditions, contact tracers would be utilized to help mitigate the spread and contact those who may be positive or have been exposed quickly. Also, for student health services, the goal is to separate sick and well visits to mitigate the spread. So we would be looking at doing testing in a separate COVID testing or sick visits in a separate location versus where the well visits would be conducted. Next slide. All right. So in monitoring health conditions, we will have a campus dashboard that will outline, will keep everyone informed of the status of positive cases and testing that we're doing at Virginia State. So the dashboard will be updated daily with daily updates to the president. And it will be managed by Student Health Services and information uploaded by our Information Technology Department, as well as weekly meetings to reconcile numbers with those who have the testing numbers. All right. In addition, it's strongly encouraged or highly recommended for all faculty, students, and staff to download the COVID-Wise app. This will also help us with contact tracing so that we can mitigate the spread as quickly as possible. Next slide. All right, and then focus area 4, shutdown considerations. So we will consider shutdown in consultation with the with local and state officials and in consultation with the epidemiologist. And that is the conclusion of my slides.
Ms. Crimmins, Madam Chair, I do have one question.
Yes, Mr. Hill.
Ms. Crimmins, are there any Commonwealth or Virginia guidelines that were not included in the plan you just presented? My reason for asking this is that if we have a worst case scenario what exposure would the university have? Because somebody can say, well, the Commonwealth asked you to do ABC, and you only did A and C. Is there any gaps like that that we need to be concerned about?
Okay. Well, with that, this was just a highlight of the reopening plan. There are several other things in the reopening plan, such as the social distancing, enhanced cleaning protocols, single occupancy rooms for the students. So there are several other things within the plans. Yes, sir.
And we're compliant 100%, as far as you know.
As far as I know, yes, sir.
Thank you.
You're welcome. Come back on camera.
Thank you, Mr. Hill.
Madam Chair, this is Greg Worley.
Yes, sir.
I do have, I guess, two questions. One on the 15% sample size. How was that determined?
Well, the 15% sample size, that was determined by looking at some of the other reopening plans of other institutions and also in consultation with the Department of Health, and then also in consultation with some of the other schools in the Commonwealth of Virginia. As well, also looking at the latest literature on surveillance testing and how that's done. So we are, with the 15%, it's actually better than some of the other schools in the Commonwealth who are using a 5% model, but they do have a larger population than we have at Virginia State.
And this may be more of a legal question, but what happens if one of your population, a person in your populations or sample decide not to take the test?
If they decide not to take the test, then I think we would have to work with that on a case-by-case basis to maybe figure out the reason why and see if there was maybe a workaround, that after determining why they did not want to take the test.
Okay, I do have one final question.
Yes, sir.
Before the, and this is related to the 55 beds, I guess, for isolation and quarantine.
Mm-hmm.
We were told before that once that capacity, we've reached capacity for that 55. What happens when we reach that capacity?
Well, with the capacity of the 55 rooms, the one thing to keep in consideration is the time frame that people would be in isolation or quarantine. So we would monitor, their health conditions. I probably didn't mention that so much in the slides through telehealth. But also the period is generally 10 to 14 days where someone would be staying in the isolation. But once we reach the 55, if everyone, was in 55, every room was full, then we would have to look at that as a consideration for shutdown. But again, I would like to emphasize that I would work with the state and local officials to determine what we would, need to do as far as the shutdown numbers.
Thank you.
You're welcome.
I have a couple of questions.
Yes, Mr. Richardson.
First, I'm going to say thank you for the very comprehensive report. It looks like you've done a great job. You and your staff have done a great job developing it. Just a couple of minor questions. One, in the temperature scanner, I call it an iPad that you stand in front of and can monitor. Okay. Is that going to be in certain key locations? And secondly, is it going to be mandatory that one goes through that before entering that building? And lastly, is there anyone monitoring the monitor? In other words, if it comes up that someone has a high temperature, what's the next step?
Okay, so yes, with the temperature scanning kiosk, it would be strongly encouraged to be used, by everyone. For monitoring that, when a person walks up to the kiosk, they would get a, if they say their temperature was out of range, then they may get a message on the kiosk that they need to contact, student health or, directions to do that. The kiosk can be set up with a portal in which someone would monitor. So if a temperature was out of range, then someone in student health would get that information through the portal. So it would have to be monitored. As far as the locations for it, it would be in high traffic locations, but also considerations for in the dorm areas as well.
You can tell that I go through that on an almost daily basis every time I go through the hospital. It's pretty neat.
Oh, okay.
Yeah.
Okay. So you're familiar with it.
But our
Yeah.
security people are right there beside it. So if it goes off, there's some control of that person going into the hospital. They're prevented from going in. What about dining facilities? To me, that might be a good place too, because that's one of the places where they can remove their mask to eat. And if someone has a high fever and might be prone to have COVID-19, that would be, to me, it should be mandatory, just like your swipe for your meal ticket, that you should be able to, in order to get into the cafeteria, if you have a high temperature, you have to.
Yes,
So
I do think the cafeteria would be an optimal location as well. Yeah. Places
But
where
it
there's a
sounds
lot
like
of
it's
traffic.
optional, though. So how effective is it if I have a high temperature, then I can say that I don't want to be, I don't want my temperature taken.
Yes. So we'd have to, of course, look at the guidelines for the state with temperature, taking, whether it could be, mandatory or not to do so. But yes, I would. That is one of the generally temperature. A high temperature is the first sign of an infection. So although in some COVID-19 cases, people may not show a temperature, it may also indicate something else, such as the flu or something else that we can catch early on if someone, uses has their temperature taken. So I do strongly encourage that taking the temperature.
Hopefully the state will support it being mandatory, because I mean, they're telling us that we can't be with 25 people in a room and not you have 25 people who don't have it, but yet we are required to abide by it. Okay, it seems to be it's the best practice. And
it's
lastly,
the best practice.
Right. In terms of reporting by category, I couldn't see the graph very well in terms of what's being measured on it. Will it be done by category, for instance, by students, by staff, by athletes, or whatever, or just it will be VSU family in general?
Yes, that graph that was there was just an example.
Okay.
So not necessarily what we would use, but that would be right now we're outlining what would actually go on the dashboard and what would be reported. So definitely we know that positive cases and also some of the things that are reported by other institutions are just the testing overall, how many people were tested, through surveillance testing or symptomatic testing. It can also be broken down based on students versus faculty and staff. So there's a number of things that can actually go on the dashboard. It's just, we're just looking at what will actually put on the dashboard. That would be done through student health.
Great. And lastly, I assume the tracers would work to identify any hot spots. If there's, I'm sure that's part of what the tracers are doing. So you'll be able to tell if it's a particular dorm, or if there were a party, or if there were people in a particular department. Because unfortunately, here at the hospital, we lost an employee because they were eating in close quarters in the lunchroom, and someone brought it in from the outside, and we actually lost somebody. So there are hot spots all over place.
Yes, that's one of the reasons for the surveillance testing as well, or prevalence testing. So, we can identify populations, or say dorm A has a certain number of students test positive in dorm A, then we can kind of trace that and figure out, where it started. So that's one of the reasons for surveillance testing as well. But I strongly emphasize too, because testing is just one piece of it, but those other factors such as wearing masks, washing hands, social distancing all play an important role, whether we're on campus or, outside of the campus. So those things will have to be, education is key. As far as the contact tracing, if someone is positive, the contact tracer would find out who their close contacts were, and they would be able to, contact those people and then let them know what their protocol was, whether they need to isolate or quarantine. And then this will also be done in addition with the Department of Health, because they do the contact tracing as well. And any positive cases would have to be reported anyway to the epidemiologist.
Thank you. And one
You're
last
welcome.
suggestion, that as we embark upon the holidays, what we're doing here and telling every other organization to do is to encourage people to, to adhere to specific guidelines relative to the holidays, because that's going to be a spreader too. Because our philosophy is if society has a normal Thanksgiving, then we're going to have a tragic Christmas. So
I agree. So
okay,
one of
so
the
just some advice. I'm sure you can. I'm trying not to tell you too much, but I'm sure you'll take care of it.
No problem. So one of the things that we're already doing on
Right.
student health is sending out information to faculty, students, and staff about how to protect themselves during the holiday break. So
Right.
again, back to
Great
the
job.
hand washing, mask wearing. I know people will get around their family, and they may become a little bit lax, but that's where you can start having more of the spread or super spreader events. When you're not eating, then really should put your mask back on if you're not with people who you you are normally with. So,
Great job.
yes.
Thank you very much.
Thank you.
Thanks so much for all the work you've done and for the presentation to summarize it for us. Perhaps through the president, you could circle back on what you find out from the state with respect to the dining halls. I think that's a real good suggestion. And so if we find we're able to do that and make it mandatory, I think this committee would be interested in finding out what you'd heard. And finally, and I know we need to move on, I assume that you're in contact with other institutions, your peers at other institutions who have had students on campus this year, and that the practices you put forward are informed by their experiences.
Yes, that is correct. I have been in contact with several institutions throughout the Commonwealth, and also even outside of the Commonwealth as well, and just finding out, what they've done, what worked, what didn't work, testing strategies, as well as in contact with those at the Department of Health, both on the local and state level. Yes.
Sounds good. Thank you so much. If there are no
You're
other
welcome.
questions,
Yes.
I'll go back to. Yes, sir. I'm sorry, Dr. Hill.
I'd like to build on the point you made. If there's anything else that needs to be looked at, that it flow back through the president. Part of my life is in a healthcare environment as well, and one of the concerns that I have is that people use all kinds of masks, and I'm concerned that we're without a standardization of mask. The mask may not be doing what we want them to do, even if they're saturating the entire campus. And my concern is whether or not the Commonwealth will simply say, unless DSU, unless all of your students use mask A type, then you're not in compliance. And that's my concern about liability, because we do see all kinds of masks coming into our clinic, and we're concerned. They're not all the same.
Yes. So one of the things with the as far as our move-in process, the students will be given a grab bag, and some of the items included in it would be hand sanitizer, facial mask, and I'm getting the other thing, and a thermometer to use. But also, in addition to that, we're looking at setting up dispensing stations throughout the campus that has the PPE. But I could put something together with the different levels of masks and who should use what.
Great. I've seen too many fraternities and sorority masks, and I'm not really sure anybody cared about the safety of the mask.
Yes.
The colors.
Mm-hmm.
And the
There are
proper way
different
to
levels
wear
of
them.
masks. The proper way to wear them, not under your nose, not under your chin. Yes, that's correct.
Thank you.
You're welcome.
Okay, thank you. And Dr. Palm?
Yes, and again, we'll go ahead and keep it moving. Mr. Harris, can you go ahead and set me up with regard to my presentation? What I want to also let the board know is that we put together or reactivated the task force for the university. And again, a lot of information. It was truly a shared governance opportunity for us to really provide input into this particular plan. And so very comprehensive, faculty, Senate staff, Senate student, government, everybody was involved with actually putting this plan together. I'm very happy for the results, and we are going to make sure that we do the best we can to keep the campus safe. All right, so we're going to go ahead and move on to my presentation. Next slide, Mr. Harris. So the next slide is just an outline of what we'll be presenting today. Of course, we just went over the spring 2021 reopening plan. We'll talk a little bit now about the SCHEV performance measures, enrollment, retention efforts, retention rating efforts, as well as new program update. And then we'll finish up with student success and engagement. Next slide, please. So we wanted to actually talk about the SCHEV performance measures. As you are aware, that SCHEV has given us our report card with regards to our assessment on how we did with the 6 performance measures. I would just be very candid up front. I'm not happy with regards to our results of the particular measures, but also want to provide some I'm sorry, Mr. Harris, you can back up again. Provide some also context to some of these particular measures and also a path moving forward. Can you go back one more slide, Mr. Harris? Right, okay. So, of course, we know that if all measures are met, then institutions will be certified by the council. If they're not met, then the council will actually work with the institution to help develop a remediation plan and really work with the institution to move the institution forward to meeting some of the actual particular performance measures. Just upfront that we are working with SCHEV as we speak right now with that remediation plan. And I'm confident with as we move forward that we will be able to address some of these, well, actually all the actual measures as we move forward. Some of this will actually be throughout the presentation. I'll talk to you about that as we move forward. Mr. Harris, next slide. So of course, there are 6 performance measures. And the very next slide will indicate that of course, they are assessed every 2 years on the even year. Back up one more, Mr. Harris. And performance measures 1 through 4 are based on projections. These are projections that we as an institution make. Nobody instills these projections on us except ourselves. And so these are truly direct comparisons of actual versus targets. And so we identify what numbers we want to make or actually project, and we try to make sure that we achieve those particular targets. The targets are approved by the state council, and you must really meet at least 95% of those particular projected targets. Also for performance measures 5 and 6, they are actually based on averages. And the goal is really to maintain or increase the numbers with regards to those particular averages. These particular performance measures were actually established in 1617. So a lot has happened since those measures and the projection of those particular measures in 16 and 17. And I'll actually talk about some of the things that we have in place now to really assist us with making sure that we hit our mark moving forward. Next slide, please. So I want to get into the details of some of the data that we and our particular measures, but just in general, the projection targets. Again, the current cycle was from 2016 to 2022. The years in review, 2017 and 2018, actually they're being reviewed at this particular time. So we're reviewing years in the past. So 2017 and 2018. And then 2019 and 2020 will be reviewed in the fall of 2022. The next cycle for new projections will be the academic year 2021 through 2024. Projections will be submitted for the upcoming years in the spring of 2021. So as you can see, the cycle, again, there's certain dates in which we have to do these particular projections. The projections that we are talking about today and the measures that and the numbers that we have were projected back in 2016 and 2017. And again, I have some information with regards to how we move forward. Next slide, please. So performance measure 1 was dealing with in-state enrollment, undergrad headcount. And of course, in 2017, 2018, our target was 3,058 students. The actual, or the number that we met was 3,169 students. We were about 103.6% over our particular target. So we were able to meet that particular target in 2017 and 2018. For the 2018 and 2019, we fell short. Our target was about 3,112. We ended up with 2,900. We were about 2% off of our 95% benchmark, and we did not meet that particular target. One of the things that I would say with regards to that particular target, if you remember back in 2018, we had a drop in enrollment, about 266 students. We fell short in our actual enrollment itself. And so, of course, that would have been reflected in this particular performance measure moving forward. And so one of the things that we'll talk about, how do we address this? Many things that we put into our strategic plan, which was just approved last year, will address a lot of these different areas as we talk about enrollment and moving forward. And so what I want to do is, if there's any questions on the particular measures, we can actually stop and work through those particular questions, and then we can move forward. If not, we can wait till I finish the whole presentation with regards to the performance measures. Are there any questions with regards to the actual performance measure 1 and the enrollment? Okay, performance measure 2. And this is dealing with degrees awarded for in-state students. These are degrees awarded in general, and then degrees awarded with our STEM bachelor degrees. And so our target for at least the degrees awarded in general of our in-state students was 656 students. And we actually awarded 552 in-state students that particular year, and we fell short, as well as the following year, which we increased that number to 662 as a target, and we fell short at 491. And again, we did not meet that particular target. One of the things that I want to say also, since these particular projections were put out there, what I realized is that when I first came to Virginia State University, that we really did not have the technology to really do a good job with the data analytics and predictive analytics, and really trying to project where we would be at with regards to our enrollment, our degrees awarded, and other things, even within these performance measures. One thing I'm happy to say is that since then, we actually have a tool in which all we have to do is flip a switch, and we can really identify where our students are throughout their matriculation, whether they're in-state, out-state, whether they have a balance on their particular account, whether they are making progress towards their degree, and what are some of the barriers that they are actually dealing with. And so Now we have the technology. We didn't have the technology back in 2016 and 17 when we made these projections. We have the technology now to be a little bit more accurate, and actually very accurate, with actually making these particular projections moving forward. So I'm happy to know that we have that technology in place. We were a little bit ambitious with these particular numbers in 2016, 17, and projecting where we would be at with regards to degrees awarded, as well as with our STEM-H degrees that we awarded. Although we were a few students off with regards to our STEM-H, again, our technology now that we have in place will actually allow us to do a better job of actually projecting these particular numbers. One thing I would tell you is that back in 2016, 17, it was very difficult to know if a student changed their major, if they were a STEM major and they changed their major, and then how do we calculate that moving forward with projecting the number of actual degrees. And so now we have the technology, we can track our students, we know if they've changed their majors, and then we have a better job of a way of projecting those particular numbers. The other things we put in place also for our STEM-H is that we just hired a STEM director to really actually help with supplemental instruction for our STEM students, but also work with our faculty to become and work with development with innovation in their particular classrooms. And so really keeping our eye on our STEM students, but also broadening the programs of STEM. The other interesting thing as we take a look at these in-state numbers is that our numbers in general for our STEM students actually increased. The STEM degrees actually had increased. However, our in-state students degrees did not increase. And so again, we want to make sure that we are keeping our eye on that. Many efforts that we put forth in the strategic plan also will address some of these particular performance measures, as I mentioned. Next slide, please.
Dr. Palm.
Yes.
Madam Chair, this is Greg Worley. I do have a question. On the 2017 and 18, those targets were not met.
Yes.
Was there a remediation plan for that, for that 2017-18 year?
Yeah, so Mr. Worley, those particular these particular results are being, of course, were just assessed for the 2020 time period, and so of course that happened in the past. The remediation plan with regards to all these particular performance measures actually are tied into our strategic plan, but also specifically some of the things that we have been doing already in place to really improve our graduation numbers as well as graduation rate, but also helping our students matriculate in a very, very timely manner. What I would tell you with these particular numbers, and I want to be very clear, was that they were ambitious with regards to the targets that we set for ourselves. So no one set these targets for us except us, but we would have been able to set a better target if we had the data analytics in place that we could really, put a target that we knew that we could make. So I'm not upset about the target because, again, in order for us to improve, we have to set ambitious goals. I think we just have to be a little bit more careful with setting more realistic targets versus some of the ambitious targets. So the remediation plan is we've been putting things in place all together and to address our graduation, our retention, as well as progression of our students. And Dr. Alexis Brooks-Walter will talk about some of those things in the presentation behind myself today.
Dr. Paul, if I could
restate my question, because maybe I didn't say it clearly. I thought that Chev would go through and do an evaluation in the even years. I thought that's what you said.
Yes, yes.
So in 18, was there an evaluation done of VSU as it relates to these targets? And was there a report? And if they were not met, was there a remediation plan done at that time? Right.
So the years in which Chev evaluated or assessed was 15, 16, 16, 17. It was not these years in 2018. As you can see, they're 2 years behind. Right now we're in 2020. They're just now assessing 17, 18 and 18, 19. in 15, 16, 16, 17, we hit our targets. There was one that we did not make. I can't remember which one it was, but we hit our targets in 15, 16, 16, 17. Does that answer your question?
Yes. Thank you.
Thank you. I think I heard the president chiming on that, but I'll continue until he chimes back. Did you want to say something?
I was gonna also restate the question because I understood his question. I wanted to make sure that you heard it.
Okay.
It. But if he's fine, then.
Thank you. For performance measure 4, when we talk about progression, Virginia State did a good job with regards to junior and senior level students with regards to a 4-year institution. And they're actually full-time equivalent students. As you can see, we overperformed in this particular measure, which I feel good about, is that our students are progressing through. It's just a matter of getting them through to the finish line with regards to graduating them. And so we did meet this particular measure. So 1 through 4, again, were projections that we put on ourselves, and that, again, the 1 through 3, we had a hard time meeting. Next slide. The next slide, again, these are looking at averages. And so these are degrees awarded for students from underrepresented populations. If you take a look at how SCHEV identified their target number, they took an average of the underrepresented populations who graduated in 2014, 2015, 2016, and came up with a 3-year average of 573. And then they compared it to our 2-year average of 17 and 18, in which our average was 507 of underrepresented population of students with degrees, in which we did not meet this particular standard. Now, what I would tell you is that most of our students are underrepresented, are of the underrepresented population. However, if you take a look at the number that graduated in those 3 years compared to the 2 years, we did not meet our standard. And so we had a long conversation with SCHEV with regards to that. And as we move forward, we really are looking at if there's a way to have a better way of looking at this particular measure, in which we know that the majority of our population is underrepresented. Next slide, please. In the 6th slide, 6th performance measure is really our 2-year transfer students. And again, they looked at a baseline of 163 that back in 2010 and through 2011, and they took an average of our 2 years of 2017 and 2018 at 152. So we're about 11 students short. I'm not happy with that as well. This all goes back down to our recruitment and enrollment. A number of different things that we are put in place for at least our 2-year transfer students. These are 2-year transfer students, of course, students with degrees from the community college. We do have a number of students that transfer in, but they have not received their particular degrees. But again, as we move forward, we have put together the Trojan Alliance with Richard Bland College. We also are working with SCHEV with some of their passport and their transfer services, and really developing and enhancing our website to be more inviting for our transfer students. We're also working with developing a transfer center, not only with admissions, but also in our ACE, Academic Center of Excellence, that can really help provide the support for our transfer students. So there's a lot of different things that we have in our strategic plan that is also going to help us address this particular measure as we move forward.
I have a quick question.
Sure.
And I know that we have a good relationship with the local community colleges, and some of the transfer initiatives have been primarily focused with them. What about the other community colleges? I mean, I know community colleges in general have seen a decline, but we have the distinction in Fredericksburg of having one of the few community colleges that's really growing. And I'm just not sure if we need to broaden our scope, or if there's some things that some of us can do to help. Just a question.
Yeah, a very good question, Visitor Richardson. What I would tell you is that in the process that we went through with regards to our strategic plan, we do not want to leave a stone unturned. And so one of the things that we actually had our chairs and department chairs, as well as our faculty and deans, work on is really a recruitment plan. We just had a meeting last week with several community colleges in the area, as well as throughout Virginia. And we had a great conversation. This is really working within our engineering technology program. And we had many of the counselors and advisors from the community colleges on that particular call. And it was a great meeting. We led with our students and showing the successful students that we have and the outstanding faculty that we have, and really setting up a true relationship with these particular community colleges is really our goal. I think that we really surprised those particular participants about the value of Virginia State University, and letting them know that that we should be the top on their list if you're looking for outstanding programs. And so we do not want to leave any stone unturned. We want to reach out to all the community colleges within the Commonwealth and really develop a true relationship. But also we're working with the actual programming and really the curriculums in those particular colleges, so they have a smooth transition into Virginia State and they do not lose any credits. And so really trying to really ramp up those efforts as we move forward. So yes, we want to make sure that we are leaving no stone unturned. Okay, that's great. And I think it's good that we're showing them the product, but also I think that we need to emphasize, we probably are doing it, our expertise relative to teaching and training and graduating first generation and economically disadvantaged Pell eligible, because that's where a lot of those kids who are in community colleges, some of them, there probably is a large percentage of them as well. Thank you. Thank you. Next slide, Mr. Harris. So some of the things that we're working on now, we actually have submitted a draft of a remediation plan to SCHEV. We are really refining it. As soon as we received our report, we reached out to SCHEV and they worked with us. We actually, what we submitted to them, they were really excited about that we already have some of these particular things in place. But we are working with SCHEV right now as far as a remediation plan, as well as a timeline on which we will be able to achieve, our particular projections, as well as some of those averages in which we are going to be held accountable for. So just in general, and again, I think many of you have heard a lot of different things that we're doing, our Out and For initiative, the transfer initiative, we have the Trojan Alliance program, as well as the transfer equivalency website. We are actually working on our degree audits and making sure that our students are on track to graduate. I've put a request out to the chairs and deans that a graduation degree audit should be done at 90 credit hours, so that students don't get to the finish line and end up not graduating because of one or two courses. Of course, we are working on a high-tech, high-touch advising system that you'll hear about in a few minutes from Dr. Brooks Walters. Again, enhance and tailor student success initiatives that we're meeting with students individually and really trying to help them through their particular issues, and tailoring the different types of experiences for those students for them to be successful. The early alert system, I'm very excited about our EA-based system. This is really not only being used to alert the faculty, staff, and advisors when students are in trouble. It also helps the students know they're in trouble. But this is the same system that I was talking about with regards to the analytics and helping us understand where the students are and helping them work through the actual progression to graduate. And so we can, like I said, flip a switch, do a filter. We know all our in-state students. We know all the students who have a balance of over $10,000. We know all the students who have a GPA below 1.5. We can really then go with a better projection as we move forward with SCHEV and projecting our particular performance measures and what they would be. Also, we are implementing the academic support counselors and graduation specialists in each college, and also actually have developed and we're ramping up a supplemental instruction program to support students' academic progress and progression through the university. Many of these things we have grants for. We've also requested money from the state to really help support some of these particular initiatives. And I'm very excited about a lot of different things that we're moving forward with. The next slide, please. The other thing that as we were actually developing and really putting in infrastructure for the strategic plan that just launched in September of 2020. So we just launched the strategic plan, but we worked with the deans and the various departments to really leverage the data and to engage strategic efforts to really focus on enrollment, retention, progression, and graduation. So we're really taking it down to the deans and chairs level to really help with those particular types of initiatives. And we've had workshops and as well as developmental seminars for our deans and chairs to understand how to make this happen. We also made sure that with some of our projections with the strategic plan and some of our benchmarks, that the colleges and departments know what their role is and what their contribution to the strategic plan is going to be. So right now, we're also providing the deans and chairs with early registration reports, and they're getting those reports daily to understand their students that may not be registered, how they can reach out to those students and make sure that they're registered, making sure that those students are validated. They're getting retention reports with regards to within their college. If for some reason the students aren't returning, that I want the chairs and deans to know why they're not returning. And if they just need to make a personal phone call to get those students back, then that's what they're doing. Also, we're monitoring the change of majors. So again, if we talked about the STEM-H majors, if for some reason we projected that we had this many in the pipeline, this many enrolled in STEM programs, but we also have a trend of how many transfer out of those programs, we can do a better job with making projections on our STEM majors. And then also, we're looking at students slated for graduation earlier. Again, understanding what hurdles may be in the way and carrying those students through the finish line, whether it's finances, whether it's a class that they need to take that we need to offer special for that student, or if that student just needs a push to get out into the real world. We want to make sure that we are addressing those particular issues. And then, of course, facilitated direct student contact and support. So we just want to have a wraparound service to make sure that our students are going to be successful. And as you can see, this really impacts our strategic plan priority number 2, objective 2.3. Next slide, please. I believe that's it for the SCHEV performance measures. I would like to open up for any questions before we move into Rodney's report in regard to the actual enrollment.
Madam Chair, this is Charlie Hill. I have a comment and a question for Dr. Palm, and I have a question for Mr. Murray before he leaves. I'm mindful of the fact that he's going to be leaving in a few minutes. So, Dr. Palm.
Yes.
I was surprised and embarrassed when this information about these measurements, these standards, were reported. And I'm reminded of the work we did on the strategic plan. And as we were working through that, I didn't hear anything about these standards may be in jeopardy, etc. So my question is, are there any other SCHEV or any other requirements from other agency that we've fallen short or done well on that we need to know about as a board?
Yeah, so thank you, Mr. Hill. I have to admit that we should have had our hand on the pulse with regards to this particular report coming from SCHEV. Ironically, our SWOT analysis that we did with the strategic plan addressed all these things already, and so I feel very confident moving forward. I really, again, feel embarrassed because, again, this should have been out to the board back in 2018. What I would tell you is that there are no other agencies with regards to this type of measure with regards to falling short. What I will tell you, though, is that the 2019, again, we are, because of the projections as well as our enrollment, are going to be impacted for the 2019-20 measures. And Chev knows that, and we've had a conversation already with Chev. And so part of the remediation plan isn't about 2019, 2020. It's about 2021, 22 as we move forward. And so managing those expectations, but also understanding that and working with Chev, besides the enrollment piece, a lot of it is really dealing with projections and being good at it, but also pushing yourself to a point where you don't want to undersell. You want to push. You really want to push, but you don't want to be so far out of the range that you can't hit your mark. And so Chev, and you'll hear from them tomorrow, as they have done with other institutions who haven't hit their mark, is they'll work with us, and they're really excited about the things that we've presented to them already. And so I feel good. I'm embarrassed. I'm disappointed, and I take full responsibility for these particular measures. But I'm truly, and the team has been working hard, the faculty, staff, and the deans. We've been putting things into the strategic plan that I know that SWOT analysis already gave us these particular measures, and we knew that we were falling short on.
Okay, thank you. And I may have to come back to you depending on what Mr. Murray says. Mr. Murray, are you still on?
I think he had to sign off at 10 o'clock, Mr.
Oh,
Hill.
I thought it was 10:30.
Oh, I'm sorry.
No.
Okay.
And I worked with Chev on these in a previous life, if I can help. And we will also have Jean Murray and Todd Massa at the meeting tomorrow. And
Fine.
obviously Bill will be at the meeting tomorrow. So how would you like to progress?
Probably, I want to ask the question now and follow up tomorrow.
Okay.
My primary concern is SACS. You made a point of saying, Madam Chair, that there was no accreditation issue when you were introducing this segment, and I'm unclear at this point about why there is not an accreditation issue. Having worked with SACS before on their last visit to Virginia State, having been interviewed aggressively by them, it didn't seem to matter if we really had a problem. What seemed to matter was the appearance of a problem, and that caused quite a bit of a concern to us as a board, and me in particular. And I want to just be sure that we fix everything that we can fix that need to be fixed, including with SACS. So I want to be able to know for sure why this is not an accreditation issue from SACS perspective, not from our perspective, not even from Chev's perspective, but from SACS perspective.
Right. And I will say that with respect to, and I'll let Dr. Abdullah, because he's on the SACS board, I believe, respond as well. When I say it's not an accreditation issue, if, I guess, like the last time, it hit the media in a big way and was, blown out of proportion, I guess it could become that. My point was that from the state perspective, this is not any kind of an accreditation issue. I also think, having served for a number of years on the SACS, COC peer-to-peer review committees, in looking at other institutions and with the training that I received from SACS in looking at institutions for substantive change and just for their normal reaccreditation processes, I would not have taken a state financial and administrative and academic requirement that is the upshot of specific Virginia restructuring legislation as something that I considered in my reaccreditation or substantive change. It's something that, I guess if I were to liken in the simplest terms for me, the projections and the emphasis that Dr. Paul made on the projections, it would be, if I said I'm going to lose 10 pounds, and you say you're going to lose 20 pounds. Well, I lose 9.5 pounds, so I win, and I get sustained by the state. But you lost 18 pounds. Well, you're just better at projecting, or I'm better at projecting. The goal has nothing to do with it, really. We just didn't do good jobs of projecting. So I think what Dr. Palm said with respect to the increased emphasis that we have and capabilities that we have with respect to data analytics that we have talked about every year that I've been on the board. We've really emphasized and built that infrastructure. I think that if anybody from what we missed on these academic standards, I think they wouldn't endanger our accreditation at all. I just intuitively and from my experience would say that. Yeah. I do also want to ask, and Dr. Palmer, Dr. Abdullah can go into this. We know that for 1920 and 2021, everything is going to be off, from community college transfers to our own enrollment, hence our own degrees. And are we making very realistic projections, and will we have an opportunity to make very realistic projections before the next time, in 22, that we would be looking at this?
Okay. Well,
yeah.
I guess, Dr. Palm, I think I hear you getting ready to say something. I would just respond to Madam Chair. I would like to continue this conversation tomorrow when the folks from Sheriff are there. And I remain concerned about an accreditation issue from SAC's perspective.
Thank you, Mr. Hill. What I would tell you is, again, SACS really believes in continuous improvement. And so, we set a mark. We didn't make it. This is truly assessment. We try to achieve it, and they want to see what we did to achieve it. And so they do not penalize you for putting things in place and not hitting your mark. They want to make sure that you're showing assessment and that the assessment is being done. And of course, we have the guru, Dr. Minister, making sure that that happens. And so I'm excited about that piece.
If I was to add a little more, I want you to know, Mr. Hill, that the comments that Dr. Palm is making, that I'm making, are comments that we have actually reached out for guidance from our vice president from SACS. And so we are very clear that that it does not trigger, a visit or an accreditation challenge. They also are aware of the challenges with the audit because there's financial things with this too. Audits, of course, that happen at every institution. What they want to know is that when we get an audit finding, that we work on our audit finding and that we solve them. And so we have reached out for guidance, and we have received guidance that, if there is an issue, that they will let us know. But we have not been informed of anything, and we remain in constant contact. And so I want you to know that this is not kind of a one-sided conversation. What we're telling you is what we have. When was that? Was that yesterday, Palm, that you talked to Stephen Sheehan, our vice president?
Day before yesterday.
Day before yesterday, and they haven't. So we have been communicating in an era of transparency because we knew that this is a concern. It's a concern of yours, and to be honest, we know whenever we think about sex, that's a concern of ours. We always want to make sure that we are on the right side of history. So, yes, sir.
Thank you.
Madam Chair, this is Greg Worley. I do have a question about the repercussion as it relates to the financial benefits. It said something about if we didn't make these SHEV standards that we may not share in the financial benefits. Could someone explain that to me?
I think Mr. Davenport is best at that. I think he was going to cover that tomorrow. I don't know if he's on now, but I think he was going to cover that in the facilities finance.
Yeah. So, and I probably would go out and also indicate.
Can you hear me?
Yes, sir.
Yeah, the financial benefits are actually in a couple of different pieces. The first and probably the largest one for us as an institution is the interest earnings on our auxiliary and our E&G funds. On the auxiliary side, we've seen some pretty good growth over the last couple of years. So we typically, we've seen it as high as about $500,000 in terms of interest earnings on the auxiliary side. Last year, we were about $568,000. On the E&G side, we typically carry balances a little bit less. So we're looking at about $100,000 or so. And also potential losing the carry forward balances. And as you know, that can, vary from anywhere from $0 to a couple of million each month. And then the last piece is some rebates
each year
relating to EVA and relating to the small purchase charge card. Those are typically pretty small for us. We could lose about $50,000 a year.
Mr. Davenport, you said each month. You meant each year, though, correct?
I meant each year. Yes, I did. Did I say month?
You did. You did.
That year.
So, Mr. Davenport, if from what I'm hearing you, if we do right by our remediation plan, then next year we would be able to share in those numbers that you just talked about, the interest on the auxiliary E&G and the carryover and the rebates. But if we don't meet our plan, then we could lose those funds. That's what I'm hearing.
And to be clear, nothing has happened to us now. We still will get those carry forward funds and get the interest earning. But yeah, if we fail to have the appropriate remediation plan in the spring, then we could potentially lose that. Yes.
Well, I want to be.
My next question would, how is this committee going to monitor?
Mr. Worley, hang on one second. The provost had a follow-up to that, and then we'll get back to you.
I want to be very, very clear that, again, the non-certification is not due to these performance measures. Okay, so I just wanted to make sure that so